Secretos con los maestros. Dr. Richard Gentile.
Para mí es un honor y un placer estar acá sentado con Richard Gentile. Richard es una persona que quiere mucho a Colombia, ha venido muchas veces a Colombia y es una persona que tiene una experiencia muy amplia en todo el tema de rejuvenecimiento facial. Él es una persona que ha introducido nuevas tecnologías a la parte quirúrgica y vamos a hacerle unas preguntas para que él nos cuente qué piensa sobre el rejuvenecimiento facial. Richard, welcome to this podcast. Basically, I was introducing you, telling you that you're a person that has a lot of experience, that you love Colombia, and we are really, really happy to have you here with us.
All true, and it's just such a wonderful time. I love traveling to Colombia, and we started probably 2008. This is about my sixth visit here. 3 times to Bogota, then Medellin, and
In Cartagena also.
Cartagena also. Always wonderful. The courses are first class. Everything about it is great. So thank you for the invitation.
It's a pleasure to have you here. This idea of this podcast is we want to know a little bit of your experience. When did you start doing your deep planes?
Well, in our training, we get introduced to surgical techniques for facelifts. But I trained in 1987, so the paper on Deep Plane hadn't been published until 1990. Interesting thing about Sam Hamra, I learned Deep Plane facelifts from Sam Hamra. He never published a paper until he was 48 years old. And I asked him, I said, why so late? He says, I didn't have anything to say before that. And now he's obviously one of the most technical innovators in introducing Deep Plane and then also composite. So I started after I did a course the Cleveland Clinic sponsored in Florida in 1994, and in 1995 they did 2 courses in 2 consecutive years. One of them I got to work in the cadaver lab with him. So it was after that I adopted it. But as you know, when you first start doing a new procedure, it can be a little, there's some anxiety involved with it, especially when it's considered one that has a little bit more risk, and Deep Plane is like that. So, we started at that point. I did them pretty much dedicated for 12 years. And then we modified a few things, and that's the topic of some of my lectures, is the modifications that we found are helpful. It's mostly getting better results in the lid-cheek junction. So we're going to talk about that tomorrow.
That's great. If you want to give a new surgeon that's starting to do the Deep Plane facelift, what would be 3 advices that you would give this guy?
I think number one, my motto, which has evolved over the years, is do as little as possible, but as much as necessary. So like starting out with procedures that are lower risk, limited risk to the facial nerve, limited risk of hemorrhage, bad scarring, get comfortable with a less is more operation before you jump in to a deep plane.
Okay.
And usually that's what happens. Frequently, we can see people's results. I'll see people transition to deep plane. I'll see their results get better. But, we have always done deep plane, since 95. And all we do now is we modify it. So I think you have to start small, feel comfortable, and never do anything that is above your comfort level. When I teach my course in Italy, we have an advanced facelift course masterclass in Milan. I had a surgeon who was visiting from Lebanon, and he was there for one specific reason. He's great practice, high patient satisfaction, and he wanted to know whether he should do deep plane. So he came to the cadaver lab, and at the end of that, he decided it's not for me.
Okay.
I respected that because, his results are good. And right now we're in the middle of the reintroduction of Deep Plane. Deep Plane is 30 years old. So it's not a new procedure, but people are embracing it. And there's all this excitement about Deep Plane when actually, it's 30 years old.
It's interesting.
Mm-hmm.
Many people fear about complications. Do you remember one in your mind that marks your career with a complication in a deep plane facelift?
Usually the types of complications you will see are either temporary nerve injuries wound problems, hematomas, skin necrosis, those sort of things. But yeah, I had a lady we did who was actually from Argentina, and after the surgery, for whatever reason, it just wasn't healing right. And so it took us a long time. But what I tell my patients is the risk of complications is 3 to 5%. The risk of a long-term problem is less than 1%. So I think for me, it's that, I explained there might be a complication when it happens. You have to realize you've been unlucky to be a statistic, but stay with us, let us treat it, and we'll get it to be a non-factor. And so fortunately, most of my patients, when I do that, I said, we talked about this. You're one of those 3 to 5%. Let's fix it and get it to heal right, and you'll be good.
Yeah, I think it's really important. When you get a complication, you have to show your patient that he or she made the right choice.
Yeah.
Use you as a surgeon because you know how to handle the complications also.
Yes.
And it's part of our day-to-day work.
Right. And for me, with 37 years of doing this, I've seen and managed them all. And it's funny because sometimes maybe like we had some wound problems not too long ago, but one had extended dissection down in this area. One had a face full of bellafill that created a lot of issues. And so, with those patients, you might expect it, but usually they're all reversible hematomas, temporary things that delay their recovery, but don't affect their ultimate result.
And one last question. Where do you think Deep Plane Facelift is going to? What are we going to do extra to get our patients happier, or what technologies, or what do you think it's going to be the future of facial plane?
It's a very good question because the key to should we change our techniques is on, when you consider the opinions of two people. The patients, do they like their results with what you're doing less aggressively? And you, do you like your result? Do you think you could have done better? So for me, when I went back to more of a deep plane approach, I had a 98% patient satisfaction rate. And so yet under the chin, there's some areas more so, I think deep plane is more important in the neck and the lower face than it is in the upper face. And that's what our lectures about acusmas are, and how we lift the cheek and the modification of deep plane that we've made. So I think for a lot of people, they'll keep getting better at it. And so, this is a win-win when patient satisfaction goes up. But also when I went back into more deep planes, complication rate went up. And so you will see more complications by doing deep plane. People try and belittle that, but I think the truth is it's a little more complicated. You'll have more temporary, nerve injuries. They go away, but you don't like to see our patients walking around with a weak lip or a weak cheek or a lip that doesn't move even for 3 or 4 weeks. It's bad for them. It makes them very concerned.
Yeah, I think this is really important, and one of the reasons we wanted to talk with you about is because we think that education and the opportunity to go to the lab dissection is crucial so you can get more comfortable doing your surgery.
Yes.
So that was the idea, to give some tips to our new colleagues, to people who want to get better. And thank you so much for being here with us.
A wonderful program. I've been honored to be able to be part of the last one, which was great on minimally invasive. And so I'm so happy to be part of the deep plane one as well. Thank you.
Thank you so much. Bueno, estábamos con el doctor Gentil, ya oyeron los tips. La conclusión definitiva es: estos cursos sirven para mejorar, para sentirse más seguros, más cómodos y poder llegar a esos resultados que nos permitan tener menos complicaciones, pacientes más felices. Y le agradecemos inmensamente al doctor Richard Gentil por estar con nosotros.